Stem cell therapies are experimental at this stage, so they are not FDA approved in the United States, and most of them are not approved by European Union either. However, the cause of Meniere is unknown, and many hearing losses do not have any clear causes either, because Meniere's disease sometimes is considered autoimmune. Most times we suspect it's because of viral infection, and post-viral infection, some structural change to the inner ear causing the hearing loss, vertigo, tinnitus, and because it's related to inner ear inflammation, for people with hearing loss, stem cell injection directly into the ear, intratympanically, may help people with severe hearing loss or severe Meniere's condition. If we use stem cells injected intratympanically to reduce the inflammation in the inner ear, at the same time, we also utilize intravenous infusion all over the body to systemically reduce inflammation in the body. Based on the mechanism how mesenchymal stem cells from umbilical cord work, we think this type of therapy will have the future helping people with hearing loss, vertigo, tinnitus, and many of them with unknown reasons. So we recently performed this intratympanic application of stem cells with a gentleman from Ireland who has been suffering from Meniere's disease for 10 years. So this was only performed 2 weeks ago, and it usually takes about 3 months for anybody to see significant improvement. However, since it's only been 2 weeks, he already said he doesn't need his hearing aids at the same level anymore to be able to hear people's conversation. He can actually tune down the hearing aid to one level. And when he is talking to people online over computer on Zoom, he can actually listen to their conversation without the caption. If you would like to learn more, please feel free to contact us. Go to our website. You can call us, text us. We're happy to answer your questions.